This is the Whole Care Network. Helping you tell your story one podcast at a time. The following Care Lab podcast does not provide health or medical advice. All content is provided for information purposes only. Listeners are encouraged to speak with their healthcare provider for specific healthcare advice and are wholly responsible for the outcome of implementing any tips or information presented. This is the Whole Care Network. Helping you tell your story one podcast at a time. The following Care Lab podcast does not provide health or medical advice. All content is provided for information purposes only. Listeners are encouraged to speak with their healthcare provider for specific healthcare advice and are wholly responsible for the outcome of implementing any tips or information presented.
Welcome to Care Lab. It's Care Lab Day.
Care Lab Day. I'm so glad to be here and to have this conversation today. And, it's Friday, so it's the best day of the week.
Yeah, I feel like it's been like a hot minute since we've had a Care Lab Day for some reason.
Yeah, I don't know why, but hopefully everybody who's listening has had a Care Lab Day every Friday because that's when we release episodes.
Yes, indeed. So don't forget that. Mark your calendar. Make it a recurring event.
Exactly.
To listen to Care Lab. We have a really, really awesome guest, as if you are watching this, you can see already. We have with us Dr. Brittany Lamb. So Brittany has the best bio, I think, ever. She's an ER physician by night and a dementia family caregiver, decision maker, educator, and advocate by day. And we're going to talk about all that with Brittany here today. But first, we have a serious question that we have to answer.
How serious can this be? I doubt it, but we're ready.
Actually, most of my icebreakers are like not serious at all. This is a more serious one. This might be a more controversial one. So, smartphones, are they good or are they evil? This is a complicated question.
Brittany, are we going to put you on the... Do you have an answer right now?
I'll answer. I'm going to say they're good. I mean, think about all the things that you can do with your smartphone that you couldn't do before. I think it's a good tool. I see the other side, though.
The evil side is not that far away. It's in the horizon. You can see it. I think with most things, one, that I answer, and two, that happen in life, there is no one right way. And I think it's very gray. And I think they can be used for good, a lot of good. They creates internet access for people who haven't been able to have it because they can't access like a desktop. So it makes it more affordable to do that. And it just gives a lot of ability to do a lot of things. Also, I think a smartphone is a really great accessibility tool because it's got all this stuff in your pocket already to help with low vision, to help with memory reminders and all that. So that's all great. However, it also opens you up to the world all the time, and you can be summoned at any moment. There's no unless you put your phone away, there's no time where you can't be gotten to. And don't let me get started on the kids on the phones.
Yeah.
So yeah, I think it's great.
Okay, so I would agree that it's neither 100% good nor 100% evil. Most days I feel like it's more evil. I won't lie. In like my own life and the way that I see it affecting the world around me. But I think that's a great point that it has given people access to knowledge in the internet who would otherwise not be able to access that. And that's a really important thing to kind of democratize knowledge, right? I mean, that's part of what we try to do here at Care Lab. I have to recognize that probably podcasts wouldn't exist if smartphones didn't exist. So there's that.
Yes.
And it does make it very convenient to accomplish like lots of different things. in a short amount of time. I think that the problem that we all struggle with is, one, like you said, there's never a time when you can't be gotten to. And also it kind of ends up resulting, the ability to do so much ends up resulting in this kind of information and task overload that I don't think, our brains really aren't built to manage that. There's this like idea of like multitasking, right? But we know really and truly that brains actually don't do that. It's what we technically call like attention switching. And when you're constantly attention switching, it makes it very hard to have sustained attention to actually do anything well. And so, like, why do we all feel so frazzled? Well, there's lots of reasons, but the smartphone probably doesn't help with that. And yeah, don't even get me started on kids with the phones. Don't even get me started on kids with the phones, like, and all of this stuff. I think the other evil is that I think there's a lack of awareness that a lot of the technology is built to keep you in it,
using it,
and keep you using it. So it's literally built to be addictive and to tell you what you want to hear. And I think unless you can put some really firm guidelines on yourself and how you're using it, there's a potential for a lot of harm to happen, both on an individual level and then, that takes a toll on our society as well. So, but on the other hand, so many amazing things have come out of this technology. So I don't know, like I said, most days I feel like it's more evil, but I have to acknowledge that you're probably right, Brandy. It is closer to gray, and there are a lot of really good things that you can do too.
And it's a way to teach you how to critically think and use it as a tool, and maybe to manage your time a bit better, and to self-discipline, and to take care of yourself and realize that this thing may be causing you harm. So I'm going to put it away. I'm going to use my do not disturb. There's a balance.
Yeah. I think ultimately it really comes down to us all taking the personal responsibility to make sure that we are managing ourselves with it, right? And part of that comes from the understanding and the awareness that it is something that needs to be managed. But yeah, we all have to. At the end of the day, no one's forcing you to keep your face on the screen, right?
Yeah.
I think that's mostly true. Yeah.
Mostly, yeah.
I was trying to come up with an example of a place where you are forced to keep your phone on your face, and there probably are some jobs that you have to do it. But
that's true.
Either way, you still have some.
Yeah, like telemedicine.
Yeah.
To limit your screen time.
Yeah, outside of work. I mean, there are certain things like we got to be on the screen to accomplish certain things in our day. But then when you don't have to be on it, maybe it's a good idea to like go for a walk or ride a bike or, read a book, something like that.
Anyway, not on your phone, in real life.
I know, I was going to say that. In real life. In real life. Real book, library. Okay, so are we ready to dig in here to our actual real serious topic?
Yes. Although I will give you credit, that was actually a serious question. We don't usually start with the icebreaker with a serious question.
Yeah.
So I'm going to give you a round of applause for that choice.
Oh, really? I kind of like keeping it silly, but it was a fair question. It was an okay question.
Yeah. But I'm glad that gets to lead us into Dr. Brittany Lamb.
Yeah.
I may have some more serious stuff to talk about too.
Yeah.
Yeah.
So you're an ER physician. How did you get to this place where you're providing education on medical decision-making for people with dementia?
Yeah, I think there's multiple reasons why it kind of happened naturally. I've had lots of family members who I've interacted with over the years who have lived with dementia. My grandmother lived with us when I was a teenager. And then I got super frustrated because when I would see patients that came into the ER who are living with dementia, I felt like I didn't know how to help them really. Like I was just kind of shuffling them along inside of our system. It was like I was doing what I needed to do to either send them back to their facility or put them in the hospital, trying to have conversations with their decision makers when they don't have the ability to make their own decisions. They've lost capacity. That was really hard. It was like people did not know what they needed, what they wanted to do, what their person wanted. And they didn't know how to step into that power of being their voice and speaking as their advocate. So, and to me as an ER doctor, and for you all, you're healthcare professionals, like you see the same processes happen over and over again. And so when you see a person's, it sounds, maybe sometimes it sounds impersonal, but like when you see a person's list of things that contribute to their story, their medical history, their age, how tall they are, what they weigh, blah, 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 you can kind of predict in a way, like what is most likely going to happen to them from a medical standpoint. And so I'm like, okay, I have all these people that keep coming to the ER, and I could have told them like a year ago that these are the things that are most likely going to happen to your person. And these are the big decisions that you need to start thinking about now, so that when this happens, you know what to do and you don't feel so like stressed out and emotional and just not able to make a choice that you know is what's best for them. So that's why I came online. It was hurting me to see this keep happening and to feel like I didn't have anywhere to send them.
I think that's a really interesting point that you're making, because you're right. If you, at least, especially once you gain a certain amount of experience as a healthcare provider, you can look at what's going on with someone. You can see the person in front of you, and you have a pretty good idea of what the likely possible futures are going to be, at least from a medical and, maybe from a functional standpoint. So do you feel like those conversations are being had with people's primary physicians or whoever their regular physician is before they're getting to you in the ER? And if not, like, how can people help themselves to have that conversation?
Yeah, so I mean, advanced care planning is not working well in general. And I think a big problem is that primary care doctors who still accept insurance, who haven't gone concierge and haven't started direct patient care practices, which is expensive for patients. So it's like a financial situation. They don't have enough time to have these conversations. Like, to have a true conversation about what type of medical care someone would or would not want, you have to understand who they are as a person and what their values are and what's important to them. And that conversation evolves over time. And then I think translating what those values are into actual medical treatment also has to take some time. People don't oftentimes understand their disease processes. So that's another layer of things. Like, who is this person? What medical conditions do they have? And what do we need to know about that? And then how does that affect, how do the different treatment options for those things, how will those impact their quality of life and how they live on a day-to-day? It takes time. And so, I've created a process. I feel kind of weird about it, right? Because as a physician, like, I wish that this was built into routine patient care. Like, I just think that there should be an advanced care planning facilitator, a person who their entire role is to be in offices to help physicians and the whole team do this work with people, because it's so important. So I've developed a process that I have put out on the internet through a blog, through a free audio training, and then of course my program, which is a paid course because that holds all the medical content inside of it. At least giving people the steps that they need to go through to do this, and to go back to their doctor. But you're going to have to keep going back in chunks. And I think being informed and knowing what to ask for, like advanced care planning, I want to talk about my goals of care. I want to talk about my medical risks. I want to talk about how these treatment options could affect my person living with dementia's day to day in their daily life. Like, I think just people knowing what to ask for, and realizing that you have control over this as a medical decision maker for somebody. And if they care about quality of life, it's really important to do in advance.
Hey there, it's Amelia. Listen, I am so thrilled to have a great resource like Ask Sammy as part of the Care Lab team. And here's why. It's a game changer for aging in place because it makes it so simple. All you do is ask. Just type in your question or even tell Sammy what the problem is and get tailored solutions. Everything from innovative adaptive equipment to comprehensive resources. It's a great way to become more empowered, to live more independently, and to live with greater confidence. And my favorite thing about how Ask Sammy works is it's deeply rooted in dignity and practicality. So whether you're a fellow therapist, a care partner, or someone who's seeking solutions for themselves, visit www.asksammy.com. We're going to link it in the show notes so you can find it there. Start making home more accessible today. Now, back to the show.
I think that's such a important point that you talked about, and I resonate with what you say about like the reason that I started Ask Sammy was because I is because a problem I see needs to be solved, but I really don't want us to have to exist. I want it to be part of the medical process, right? And so maybe eventually it will be. And so from your vantage point, what would our healthcare system look like in our best world if you get to just like wave a magic wand and have the healthcare system look completely different? I'm guessing. How do you think it would work better for us and incorporate that?
I mean, in a perfect ideal world, there would be no money tied to healthcare.
Hmm.
And how you accomplish that and recruit people who want to do the work and compensate them and keep them healthy while they're advocating and working inside of the healthcare system, like you all and like me. Like, how are we going to compensate the boots on the ground people? I don't know. Like, I don't know how to make that work, right? I am a little bit nervous about like a government takeover completely of healthcare just because of how protocol driven they are and how
Hmm.
if you don't meet certain metrics, like you're going to fail out, you're not going to, you're not going to get reimbursed, or I'm not sure how it will work. But in an ideal wave a magic wand, it would be like we get access to what we need when we need it, and what services could help keep us healthy and keep us happy and keep us doing the things that we love would be accessible to us. So, like what you all do, people don't know the scope of practice of occupational therapists, and they don't refer to them like enough, and so anyway, that's like I could talk about this for like a long time. So I'll just end it
We
there.
we should have a perfect healthcare world episode. Actually,
Ooh, we should.
wouldn't that be good? And we could have Brittany on, and we could have a nurse on and a social worker on, and with like a big round table, all talking about visions of the perfect healthcare world. That would be fun.
Yeah, it would be fun. And then it would be sad.
And then it would be sad. And then it would be sad.
It
But
happened.
we would focus on the fun first.
Oh
Yeah,
man.
yeah.
So I guess one thing, okay, I think you bring up such a good point about if the healthcare system was not tied to money, this could be better, right? Because the first thing I think of is, okay, if we have advanced care planners in family practices in different places, how will they bill? What will they bill? At this point, this is how you have to think about it now, because this is how it works. And so there was like a recent change in Medicare's laws that allowed for billing for people with dementia to not have to be present with them. So like you could actually bill for caregiver training. And so that way you can, actually just be on the phone or in front of the person, whoever their person is, and actually bill for that time. And so my first question is, have you heard about that, and have you enacted that or know anybody who has, and how has it worked? And two, if not, how could we think about incorporating that into care?
Yeah, so I didn't know about that. That's really awesome. And I'm as an ER doctor, like I'm in that bubble still clinically.
Hmm.
And then what I do online, I have been like reaching towards a national audience. So I haven't like really, because I don't have a lot of free time working in the ER. So I have been kind of reaching out and just kind of speaking to the nation instead of my local area. So I feel like if I knew more people locally and what they were doing, then I might know some people using that type of reimbursement model. But I think that's wonderful. I mean, we definitely have to move towards getting caregivers more education, training, support services, like, and normalizing that so that they realize like there's nothing wrong with you or your person. Like, this is normal, and these are things that you will need. That's why I do teach this stuff online. I like actually today I'm releasing a video about like all the services that you need, ideally, and you guys are on there. So you guys are on my list, occupational therapist. But I feel like in order to make it work, you really do you do have to bring the caregivers in and have them have face to face with probably not even a doctor, like just some sort of person who knows about dementia education and behaviors, right? And like that access to that information is actually free online through a lot of people who are doing this work. Like Natalie Edmonds is someone that I really respect, Dementia Care Blazers. She has a wonderful YouTube channel that provides so much like free education about how to react and interact with a person living with dementia. But from an advanced care planning like that side of things, I mean, advanced care planning is covered by Medicare.
Oh.
So, and I don't know how many visits you get. I mean, there should be as many as it takes to get you an advanced care plan.
But we know how this works.
Yeah.
Yeah,
Unfortunately,
yeah,
not how it works. Yeah.
yeah, it's not how it works. So I think for people who, unfortunately, it's kind of like that whole gap that's created for people who feel strongly about this. They're going to have to do some of the work on their own and figure out this. If they have financial issues, they're going to have to figure it out more on their own, which will require them to spend more of their time, which they may not have, versus like finding an expert to help guide you and paying for their services.
I do think, I kind of want to circle back, like there are really, really great resources out there for caregivers. I do want to like highlight this important point though, that whoever you're getting your information from really does need to be it needs to be an expert who can back up what they're saying with some credentials. I think there are a lot of extremely well-intentioned people out there who maybe cared for one person and maybe they were great at it, right? And have some good tips to share, but that doesn't necessarily mean that that they're thinking about the whole bigger picture of safety or all of the other things that can go along with it. So, like, I mean, that's one of the reasons that I started higher standards caregiver training, is because people need to have a place where they can go to easily access information at a low cost, and it needs to be delivered by, you know, someone that they can trust. And of course, that's kind of where Whole Care Network came from too, is kind of bringing together lots of different professionals who are true experts in their field to provide, you know, high quality, reliable information to people. But I have a question for you about, okay, so we're talking about advanced care planning, but there are also these things called advanced care directives. And so what's the difference between those things? And tell us a little bit about that.
Yeah, so advanced care planning is the whole idea of planning for a situation in which you're not able to speak for yourself and what is important to you and what type of medical care you would or would not want. It's the whole process, and it's conversations. So it's like it's very conversation heavy. Advanced directives are pieces of paper, and they do two things, and they're called different things in different places, and different states have different rules about how they become, you know, legal documents. But they do two things. They name who you want to speak for you when you can't speak for yourself from a medical standpoint. And so like a generic term for that, medical power of attorney, healthcare agent, those are really common terms. And then the other thing advanced directives do is that you can list out what type of care is okay and not okay for you when you're not able to speak for yourself. And these documents get drawn upon when a person loses decision-making ability, either because they're in an accident, they're sick, they have a brain injury, or in the situation like what how I help people is when a person loses decision-making ability or capacity when they're living with a disease in their brain, like a disease causing dementia. So, and we know, unfortunately, the expectation is that people will have a permanent loss of decision-making ability, usually in like the middle stages of disease. So, but yeah, advanced directives, they're different. They're actually pieces of paper. And then advanced care planning is a whole process. We should also plug in medical order forms, which are different than advanced directives, because that's like the do not resuscitate, the POLST form, if someone has a do not intubate form. So these are documents that take a person's values and preferences towards specific medical care, and then check it on a box on a piece of paper that becomes an order that now medical professionals can follow. So a paramedic, 911 first responder can get that medical order form and know what to do. I can know what to do in the ER. I don't have to go to the computer and try to find this person's advanced directive and read it and interpret it. They're like immediately actionable documents, medical order forms. So extremely powerful tools, and decision makers who are speaking on behalf of somebody else can do a medical order form for a person, but they cannot do an advanced directive. So once a person's lost decision-making ability, you can't name for them what kind of care they would want in an advanced directive, or name who they would want to make their medical decisions. You can do medical order forms. So, but that's kind of, those are like the highlights of those three those three things: medical order forms, advanced directives, advanced care planning.
Care Lab listener, I have a question for you. If someone you love needed a caregiver, what qualities would you want that caregiver to have? You probably want them to be reliable, trustworthy, kind, maybe just a generally dependable and good person, right? Second question, would you also want them to be trained? I'm gonna guess the answer is a definite yes. Okay, third and final question for you. Do you think it matters who gives that training? Like, is it cool if it's just in your body, or would you want that person to be a qualified expert? Assuming you do, in fact, love this person who needs a caregiver, you probably want the expert, right? Well, that's what Higher Standards Caregiver Training does. Higher Standards Caregiver Training provides 100% occupational therapist-led training for caregivers. Caregivers get taught everything from gold standard foundational skills for transfers and daily living tasks, all the way up to how to deal with specific diseases and injuries. And most importantly, they are taught all of these things in a way that is practical and enhances the participation of the person who needs the care. And it actually protects the safety of everybody involved. Why? Because everyone deserves a higher standard. For a course for individuals or learning about training for care for organizations, find that information at higherstandardscaregivertraining.com. I have a question. So I'm very familiar with like do not resuscitate and D&I, those terms from a healthcare professional, but from a family caregiver perception, most of the time I have been asking people to like, do you have an advanced care plan, and whatever's written in there, and then translate that into whatever healthcare EMR documentation system that we have, so that you have actionable insights, right? And you're not actually reading advanced directive. So if I were caring for someone with dementia and I'm just now hearing about these medical order forms, how do I go about doing that? Does it need to be placed with every hospital that we interact with? Or do I give my advanced care plan to a case manager and they put it in? Like, how does it become an action point?
Yeah, so medical order forms you want to have wherever the person is. So wherever the patient is, the person that this form is on their behalf, you want to have it physically with them so that you can hand it to a paramedic. A lot of times we'll tell people to put them on their fridge. So that's one logistical place. They should absolutely be scanned into the medical record of any healthcare place that you access. You know, like a home daycare program. Like if someone's going to home day, they should have access to this document. If they're, having an in-home caregiver come in and be with them, they should know that this document exists. It should absolutely be on file with the hospital. So, and how you do that is it depends on the system that you're in, like that you're working within. But like a lot of hospital systems, you can fax in documents. A lot of hospital systems, you can give them to your primary care doctor's office if they're connected to the hospital, and then they can scan it in. You just want to make sure that you say, like, this is an advanced care planning document because it falls under the umbrella. It's either an advanced directive or a medical order form. It's extremely important that it's in the right section of the chart, because we have like tabs for advanced care planning in a lot of electronic medical record systems, because they're so important to be able to grab like immediately. So yeah, it depends on the system, but a social worker would also probably be able to help you. Yeah.
So when should, I think I know the answer to this, but tell us, do tell, when should people really start having these conversations? Because like you said, it's more than just having a piece of paper. Like, we really have to have conversations and understand the true quality of life and like functional wishes of people in order to have a good plan. When does that start?
I mean, it should be normalized. Like, we should all be doing this, once you're an adult human, and we're all at risk of having a sudden loss of capacity. So it just happens. Like, people fall off the roof and hit their head. They get hit by a car. Like, there's all kinds of things that happen to us. I feel like from a societal perspective, I wish that it was just more normal to talk about, hey, like, if I'm in a situation where I don't know who I am and I don't know what's going on and I'm going to be like that forever, like, this is what's important to me on a day-to-day. I think what the medical system is doing wrong is because we have lack of time. And I am guilty of this. Like, I used to do this and I felt so bad doing it that I like went online and started a business basically. But I used to go in people's rooms and just be like, all right, so you're being admitted to the hospital. If something happens and your heart stops, your heart isn't working and you lose your pulse and you're not breathing, do you want us to do CPR? Like, that is not okay. Like, it's not that what are people going to say? They're going to say, yes, absolutely. Why are you asking me that?
Mm-hmm, mm-hmm.
And we need to normalize talking about what quality of life means as soon as possible. And I think it's much more approachable than talking about treatment options, what type of care you want, because you don't know unless you know how that's going to impact your quality of life and how likely you are to survive. So, anyway, I think that it's, as soon as somebody is diagnosed with an illness that we know could impact their quality of life, the minute someone's having symptoms of a disease causing dementia, I think one of the first things that you can just talk about is, hey, like, what is a good day to you? What does living well mean to you? Because it's all different. It's different to each of us.
Mm-hmm.
And what I like to ask people to do is just go and ask your person if they're capable of this, what they do, like, on a good day. Like, describe out a normal day for you that would be a good day. And it's like, when you start getting the answer to these questions, like, yeah, I wake up at 8 o'clock and I watch, then I watch Kelly and Ryan on the television, or now it's Kelly and Michael, and I have coffee, and it's like, oh, and I drink my coffee black. Why do you do that? And like, why do you watch Kelly and Michael? Like, why? And you can get to some of that, but it has to be done in chunks. You can't just like attack a person and be like, I need to know what quality of life means to you right now.
Right.
It's like an evolving thing. So
I think that's kind of maybe that's an easier way to approach having these conversations too, because I think when we start throwing around medical terms, even within our own families in non-medical contexts, when we talk about CPR or being intubated or, being kept alive with machines or whatever that is or means or looks like to people, like, all of that is both scary and abstract at the same time if you're not seeing that on a day-to-day basis and know what that means. I think also that is a very specific moment in time when those things are being done to someone, but it doesn't necessarily speak to what their life is going to look like after those things are done, depending on what their situation and what their long-term recovery prospects really are. And that's also a scary conversation to have. So really starting from this gentle place of saying, like, hey, I love that. Like, what's a good day to you? What does quality life mean to you, on an individual basis, and really having that conversation and understanding what that means to the people that we either are caring for or may be caring for, just the loved ones that we have around us, is a good way to start understanding how we would make these decisions, given the fact that you're right. I mean, stuff happens. This isn't a conversation to just have when someone is retiring or they're in their 80s or, they're an older person. This is something, unfortunately, these things happen. And no matter who you are, you should probably have conversations to let the people around you know what your real wishes would be, thinking from that functional and quality of life perspective.
Yeah, so once we understand what someone's values of quality of life are and what it means to them, you can actually then try to turn that into a medical goal of care. And that's kind of the next step in the process. And then you can explore how the different treatment options for whatever illness they have, if they were to have a serious problem, would affect that quality of life and that overall goal. It is not rocket science. There is a process to it. And because I haven't seen people get the access to this process, I've come online to teach them how to figure this out for themselves and to know what questions to ask so that they can do this. They can feel better. It's hard. It's hard to speak on behalf of somebody else and not feel like guilt and regret and stress when you're doing it.
I also think it's really hard for us as humans to think of ourselves as not being the way we are at this moment. And until you have the perspective of time and you're like 80 and then you have lived the majority of your life already, and you do recognize that you function differently now than you did when you're 20. But these conversations should have been happening well before that, and I just think we all think we're in the top 1%. So if you're like, okay, if we do XYZ procedure, you might have 98% of people have this kind of outcome afterwards. That doesn't seem to match up with the quality of life that you expect to want to have. And everybody's going to say, well, maybe not everybody, but a lot of people would say, I still want to do it because you think you're going to be in that 2%. And I'm not saying that people should have no hope, but I just think it complicates the situation. And if we talked about it more, and hopefully, this podcast and others and your content is stuff that people interact with well before this is like maybe a true concern. It is a concern for us all the time, but we don't think about it that way until we get older. Then maybe it makes it easier to have these conversations and make actual plans for it before you actually need it. So it's, one less stressor on your family. That's the kind of way I like to label it. Because, I think at some point people are most concerned about, I don't want this to be challenging for my family. If I don't care what happens to me, really, because at that point, I don't know what's going on anyway.
Yeah.
So who is this about? This is actually about my family. And so, if you can think about it in that way, sometimes it's helpful to disassociate.
Yeah, it's a gift. It's really a gift, like to know what someone would want so that you're respecting them. And then also, if you have a value of quality of life, to tell your family, like, I don't want you to have to do these things. Like, I don't want you to be in a financial position that you're losing your job or you're having to sell your house in order to pay for my care. I mean, it all depends on the person and what their values are, but we self-sacrifice for the people that we love. And so just being more open and honest ahead of time can really help make sure like we're all in alignment when we're making these tough choices. So.
Well, this has been a wonderful conversation. I don't think it's been a serious conversation, but I don't think a sad conversation. I hope not. I mean, like you said, I think these are things that we just have to normalize talking about and understanding that lives change over time. And, there are just certain situations we're all going to have to face. So hopefully it was a helpful conversation for our listeners. If you enjoyed, please make sure that you're clicking that little button that says subscribe. Either if you are watching or wherever you're listening to us now, so you can make sure to get the next episode as soon as it drops, which is every Friday. Dr. Brittany Lamb, thank you so much for being here on Care Lab. We really appreciate you taking the time.
Yeah, anytime. I'm happy to come chat anytime.
Oh, and then can you let everybody know where they can find you and your content if they want to connect?
Oh, yes. I think if you want to connect with me via email, I typically email out on Fridays as well, and I will share like a video or a blog or a training I'm going to do. You go to BLamb, so my first name is Brittany, so blambmd.com/email, and then you just put in your name and your email address, and then you'll be connected with me. And that's based from my website, so it's blambmd.com.
Awesome. Thanks again.
Thanks for having me.
All right, guys, we'll see you next time on Care Lab. Bye.
This is the Whole Care Network. Helping you tell your story one podcast at a time. Content presented in the following podcast is for information purposes only. Views and opinions expressed in this podcast are solely those of the host and guest and may not represent the views and opinions of the Whole Care Network. Always consult with your physician for any medical advice, and always consult with your attorney for any legal advice. And thank you for listening to the Whole Care Network. This is the Whole Care Network. Helping you tell your story one podcast at a time. Content presented in the following podcast is for information purposes only. Views and opinions expressed in this podcast are solely those of the host and guest and may not represent the views and opinions of the Whole Care Network. Always consult with your physician for any medical advice, and always consult with your attorney for any legal advice. And thank you for listening to the Whole Care Network.